My name's Nate Brought. I'm a local plastic surgeon here in Franklin, located just down from Williamson Medical Center off the new stretch of Carruthers Parkway. My job as a plastic surgeon is to help you look good and make you feel better. I want to discuss today a little bit about the summer sun and the benefits and risks of sun exposure. There's a lot of different myths and a lot of good information out there on exposure to sun. The sun does provide some benefits to us. Actually, it's the best source that we have of vitamin D. And that being said, more than 10 to 15 minutes of sun exposure 3 times a week is more than enough that we need for our vitamin D. So even though we do get vitamin D orally through meals and supplements, the best way is through the sun, but too much of the sun does come with it a lot of risks. Early aging, where we see changes in skin and its integrity, and also skin cancers. Exposure to ultraviolet radiation is the #1 cause of skin cancers. Skin cancers we worry about include basal cell and squamous cell cancers, as well as melanoma. Melanoma is much less common, however it is much more aggressive, and left untreated early, it's often fatal. So when we talk about overexposure to sun, it's very important to be aware of some of the warning signs of some dangerous lesions. Basal cell cancers and squamous cell cancers do make up the majority of those, and there are some warning signs that we look for. There's some certain risk factors. Patients that are fair-skinned, light-skinned, blonde hair, red-haired patients, people that freckle easy or burn easy, those patients are at higher risk to develop skin cancer. In addition to tummy tucks and liposuction, and as well as skin care. You know, I do emphasize in my practice the importance of skin care, and I carry skin care products, and I do injectables and Botox and fillers as well as those things. I'm a big believer in the holistic approach of medicine. I don't think any one service, surgery, or intervention is a cure-all and end-all for everything. I'm a big believer in taking the holistic approach of a whole health conscientious approach. You know, when somebody comes to my office and they're interested in making a change, and whether that be a breast augmentation, a reduction, a tummy tuck, liposuction, whatever they may be interested in, when they come to me and I see that they're committed to make a healthy change, you know, eating better, a healthier diet, increasing their exercise program, cutting down on smoking, or maybe even quitting smoking, that gets me excited with them and makes me feel invested in that patient. And I play just such a tiny part of that process, but it's a very, very rewarding experience to be a part of.